Today on Tilinda program, we are joined by Dr. Anjumanara Omar, a pediatric endocrinologist at the Kilimani Diabetes Endocrine Centre. We are talking about a very important issue, the pediatric diabetes, and how we can better manage it. Dr. Omar, thank you for being with us today.
Yes, I am Dr. Anjumanara Omar. I'm a pediatric endocrinologist, meaning I deal with children who have hormonal issues and diabetes. I work at Kilimani Diabetes and Endocrine Centre, located at KMA Centre.
Dr. Omar is helping to shape the care and treatment for children with diabetes.
We don't call it pediatric diabetes, we call it type 1 diabetes. So children who get diabetes usually get type 1 diabetes. And adults have type 2 diabetes. So these are two different types of diabetes. If a child gets diabetes at 6 months of age, then it's type 1 diabetes. Children who get diabetes at during the newborn period, it's called neonatal diabetes. This is completely different kind of diabetes. So type 1 diabetes, children do not have insulin at all. They lack insulin, meaning insulin is a key hormone to put in sugar, which is in the blood, into the cells for energy. So they lack insulin, meaning the organ, pancreas, which is secreting insulin, is destroyed by some autoimmune disease that or autoimmune process the child gets. Autoimmune process, it's the body senses that organ as a foreign organ and starts attacking it. Yeah, so it's my body senses my own organ as foreign and starts attacking it. So that's what it's called, an autoimmune process. While type 2 diabetes is it's seen in adults, and it's resistance to insulin. So there is presence of insulin, but there is resistance to insulin. The body does not respond to insulin. So these are two different types of diabetes. Insulin is secreted from an organ called pancreas. It's a very small portion of that pancreas which secretes insulin. So it's just that part which is attacked, not even the whole pancreas.
Early detection is key. Dr. Omar shares the signs parents should watch for, like thirst or weight loss, which can be early signs of diabetes.
The type which is found in children is type 1 diabetes. And the characteristics are they come with passing a lot of urine, peeing at night. They can wake up several times at night, and then drinking a lot of water. If a child drinks a lot of water, then the mother needs to be aware. She needs to be concerned that there's something wrong. And then, despite eating a lot of food, they lose weight. Then they are fatigued all the time. So these are some of the symptoms of diabetes. Yeah, like the child is thirsty all the time, and the mother is breastfeeding frequently, and the child is changing diapers a lot of times, and then despite breastfeeding a lot, child is not gaining weight. Yeah, the only thing is just check the sugar. They just need to take the blood sugar. Once the blood sugar is high, it's above 11, then that child needs to be referred to the hospital.
Dr. Omar stresses the importance of diagnosing diabetes early. If not diagnosed on time, children can face serious health problems.
So what happens is, if a child is drinking a lot of water, mothers are not concerned because the weather is hot. They will attribute that to the hot weather. And because if you are drinking a lot of water, you will definitely pee a lot, and so they are not too much concerned. They're like, he's drinking a lot of water, so that's why he's going to the toilet a lot. It can be confused with very many things, like if it's difficult in breathing, it can be confused with pneumonia. If it is because as I mentioned, they don't gain weight, they are losing weight, it can be confused with malnutrition. And that's why these children can be mismanaged if the health worker does not have adequate knowledge on diabetes. And then once the sugars then start going high and high for a very long time, then they go into what we call DKA, diabetes ketoacidosis. So they come when they are very sick. They start vomiting, they have abdominal pain, they are breathless, they have difficulty in breathing. That's when now they come to the ER, emergency. If they just go to a dispensary where you don't have anything, even basic medications you don't have, then the death rate is quite high.
Understanding these risks is important.
Currently, I'm seeing around 100 to 150 children with diabetes. Yeah. If they bring them early, they are not admitted. We treat them as outpatient. So that's the cost for the parents. So the medication is basically insulin. So it's easy, and it's even less traumatic for the patients because they are not in the hospital. If they just walk in and we detect that the sugars are high, then we just do the diabetes education as outpatient, and they are okay. Compared to when they come in late, they are admitted in ICU or they are admitted in the hospital. Yeah, so it's traumatic for the patient. Imagine your child is admitted in ICU and, you know, yeah, so they don't know the outcome. So as I said, this is autoimmune, and autoimmune meaning it's genetics. So how genetics, there are certain genes which are more prone to developing diabetes, and they are called HLA genes, and 60% of the population have those genes. So do 60% develop diabetes? No, it's only very small portion of that population develops diabetes. Who does? It's very difficult for us to know who can develop. Yeah. And then what are the trigger? The trigger can be infections, basic infections like just a cold can trigger, or environment, change of environment, and stress factors all can trigger that. So it's individuals, like if an individual is carrying that gene, so there's a chance that that child can develop diabetes, but it's a very small chance, as I said. So the only treatment for diabetes, type 1 diabetes, is insulin. We have two types of insulin we give them. We call it basal bolus. So we give them insulin pre-meal meaning before meals, and then one or two insulins at in the morning or at night. So if a child is using the basal bolus regime, then they get insulin before meals, and then one that is long acting at night, either at night or in the morning. And if they are using the meal insulin and the intermediate insulin, then they use the meal insulin before meals, and then the intermediate, they use it 2 times in a day, morning and night.
Food is very important when managing diabetes. Dr. Omar gives advice on the type of food that can help keep blood sugar levels in check.
Yeah, so we tell them what to eat, like what carbohydrates they can. So we have rice, we have pasta, we have many carbohydrates, so they can eat anything. And we tell them how many grams to eat. Like if a child is a growing child, that child needs food, because even if you give that 13-year-old child 2 slices of bread, it will not be enough. So we match according to the age, and we match the insulin dosage according to what they are eating. So we don't restrict them on their diet, because these children are growing and they need food. Yes, so it has to be a balanced diet. There has to be vegetables in that plate. There has to be proteins, and there has to be carbohydrate.
Exercise also plays a big role. Dr. Omar explains how regular physical activity can help control blood sugar and keep children healthy.
So actually, exercise, we encourage them to do any kind of exercise, whatever exercise they can do. Like if the school is near and if they can walk to school, that's a part of exercise. If children like playing outdoor, like games. If they can play soccer, fine, that's an exercise. Instead of sitting and playing with their gadgets, we encourage them to go out and play. Then swimming is part of exercise. So there are many exercises. We don't tell them, okay, go to the gym and do exercise. No, they can just go and play. So playing is part of exercise, playing outside. Even those ones who can't go play outside, they can even do chores in the house. That's even part of exercise. Even doing house chores is an activity, like, because you are going from one room to the other, you are using your muscles, yeah. But just sitting and on sitting on the tablet or on the screen, yeah, that's a sedentary lifestyle. Like, once they get diabetes and they live a sedentary life, then it can worsen the diabetes.
Managing diabetes can be tough for families. Dr. Omar talks about the challenges family face and how they can make daily care easier.
Yeah, so the challenges they face is, first of all, they're in denial. Nobody wants to accept that the child is diabetes. So they go through that process of denial. And then they accept. Once they accept, the challenges is the insulin. It's an injection. It's not a tablet. So it's an injection. And they have to inject them 4 times a day. And then apart from that, they are taking their blood sugar. That's also pricking. So there's a lot of challenges because the children resist to that. It's painful. Imagine being injected how many, 3-4 times a day. It's really painful. So there's resistance. And the patient and the mothers put themselves in the children's shoes, that they're feeling pain and they wouldn't want to inflict that pain on the children. So that's part of the challenges. And then diet. It's very hard, for a kid who is used to just carbohydrate diet. Now you tell them to take vegetables, that they don't want to eat that diet, And then exercise. Children who are used to tablet, you tell them to go out and do exercise. So there's a lot of challenges. And let us talk about 18 years old and 6 months. Definitely 6 months is the mother who takes care of the child. 18 is an adolescent. So it's very different. One is an adolescent who is taking care of his own life. One is a 6 months being taken care by the mother. And even the diet is different. The 6 months is just breastfeeding. If they are diagnosed at a younger age, it's easier because they've accepted it. But if they are diagnosed at a later age, that's when the challenges come, because they're like, why me? Why do I need to change? And then there's a stigma. They are scared of that, to expose themselves to their friends because they will feel left out. So there's a lot of challenges, yeah. But you take them one by one, and we walk the journey with the parents and the children.
Technology has improved the way we care for children with diabetes. Dr. Omar shares how tools like insulin pumps and glucose monitors are making treatment easier.
So we have pumps, we have CGMs, we call them continuous glucose monitoring, where you don't need to prick all the time. So it's like a patch. You put a patch on the patient, and then either there is a reader, you scan it, and you'll get the readings, or the patch has a Bluetooth connection to the phone. So if you have the phone near you, you install the app. If you have the phone near you, you'll get the readings, like every 30 minutes to an hour. And the good thing about that is, if the sugars tend to go high, it starts giving you an alert that your sugars are going high, so do something about it. Or if your sugars are going low, it gives you an alert saying your sugars are going low, do something about it. Yeah, so that's a good thing about CGM. You don't need to prick all the time. And that's better for the children who are pricked anyway for the insulin, so we can make their lives a bit easier. Yeah, and then there is the pump. We call it the insulin pump. And these are the insulin. It's an insulin delivery system. So what happens is, it also works with the pump. So what happens is you insert the pump, and there's the patch as well. So the pump and the patch are in communication with each other through Bluetooth. So the signal from the patch goes to the pump, saying the pump now tells you that the sugar is this much, and the pump itself starts adjusting the insulin delivery. So the mothers are not too much concerned. So it's a very good technology, amazing technology, but it's the price. Everything comes with a price. We have it in Kenya, but it's the cost. If insurances can accept, and make the life easy for these children. In fact, even their lifestyle even improves. Yeah.
Support from the healthcare teams and community programs is very important. Dr. Omar explains what support is available for families managing a child with diabetes.
Yeah, so we have support groups, and the support groups, the parents support each other, and then we have this when we have the World Diabetes Day, children meet with each other, they exchange what they are going through. The parents meet because they feel they are not alone. There are other parents who are there. So such support is there.
She also talks about how we can all help support diabetic children and raise awareness about the importance of early diagnosis.
Yeah, so it's just the symptoms. Yeah, the passing a lot of. So if a child is drinking a lot of water and passing a lot of urine, that, like, let's say if that child has never passed urine at night and now is peeing on the bed, the mother needs to be concerned that why is this all of a sudden come up, not taking it lightly. Someone might say it's just stress and that's what they are going through. Maybe the child is in class 8 and so they should not overlook. Yeah, they should take it seriously. Yeah. So once they feel that the child has all these symptoms, just that they can just go to the dispensary, take the blood sugar, okay, or a chemist, just a blood sugar, because blood sugar is very cheap. In the chemist, it's like 100 shillings. It will not cost them a lot. Once the blood sugar is high, then they need to go to the doctor. Yeah, so we are there for them, and we will help them go through the journey.
In closing, Dr. Omar encourages us all to help improve diabetes care by learning more and living healthier lives.
Look out on the symptoms, and do not take it lightly. Just checking the blood sugar will not cost you anything.
Thank you for joining us for this important conversation. Together, we can make a difference in the lives of children with diabetes. My name is Chemtai Kirui. Stay tuned for more here on CAST TV. I'm Kim Natet Night.